Hello, everyone, and welcome to the webinar on civil society's response to the migrant worker crisis. Thank you so much for taking the time to join us. My name is Priyanka Dahiya, and I'm the co-founder of Daily Wage Worker Platform. Since the first nationwide lockdown, which was announced in late March, there have been several reports and articles on the plight of probably the worst affected citizens of the country, which are the migrant workers. And according to the economic survey, India has about between 80 to 90 million migrant workers. And almost half of these, which is 40 million, were adversely affected in the lockdown. They were left stranded without a source of livelihood, safe spaces, and even food. They began their hundreds of kilometer-long marches towards their hometowns because of that. And it is then when the civil society got together in different parts of the country to help the migrants in whatever way they could. The participating organizations in this webinar today also have gone way beyond their mandate to help the migrants. And with this, I would like to invite Divya Manocha from Bridge India to briefly introduce the collaboration, followed by Siddhartha Prakash, who's the founder of Daily Wage Worker Platform, to introduce the organization. Over to you, Divya.
Thanks, Priyanka. Hello, everyone. Thank you for taking the time to join us. My name is Divya Manocha, and I'm here to introduce the collaboration between Bridge India and Daily Wage Worker Platform, which has resulted in this very important webinar highlighting not only the problem that is the migrant worker crisis, but also the organizations and initiatives working tirelessly to help these vulnerable migrants. For those who are joining us for the first time, Bridge India is a UK-based charity facilitating the discourse around India and its policies. For nearly 2 years, Bridge India has achieved this by inviting policymakers, entrepreneurs, and many more area experts. During this pandemic, Bridge India has organized more than 15 webinars, and this is the first of its kind in collaboration with Daily Wage Worker. With this, I would like to pass on the mic to Mr. Siddhartha Prakash to briefly introduce Daily Wage Worker Platform. Thank you.
Thank you, Divya. So Daily Wage Worker Platform is about 3 months old. It came out of the whole COVID-19 crisis and the impact of the migrant workers and daily wage workers who have suffered acutely as a result of this pandemic. And their needs from food security to healthcare to livelihoods have been very, very severely impacted. Because they ran out of money, they ran out of food. Because they ran out of food, they could not afford healthcare. Then you had the lockdowns. And there was a lot of pandemonium, as we have seen in the media. So our target with our volunteers from Switzerland, from the UK, and based in India, we have about 20 people working with us, was really to come together and address holistically the daily wage worker crisis for the migrant workers. So the first thing we did is we noticed that there was a lot of work happening on the ground. While the government called the NGOs, civil society, private sector as a call to action, we noticed that while state governments were doing their bit and the corporates were also running feeding programs, it was really the mass of civil society, of Indians today, from communities to individuals, who really took on the task of feeding the daily wage workers in their localities, in their regions, in their states. And through the work we've done, we have documented 200 relief efforts across the country. And it is truly amazing the spirit and commitment of the people involved in these organizations to support the workers, from Amma's Kitchen in Chennai to Kolkata Rises to NGOs and organizations to even individuals like Paloma, who are single-handedly feeding 100 workers every day during this difficult time. So having done that, we also felt we need to also start operationalizing projects on the ground. We chose to start with Dharavi, which is Asia's largest slum, back in April. It was really in the grips of a massive crisis with COVID cases rising in Maharashtra. So we identified a local NGO partner, Dharavi Diary, and worked with them to mobilize $50,000. And with that funds, we were happy to say we have been able to feed 30,000 families to keep them safe during this time and fed and away from COVID. At the same time, we saw that after food security, health was a massive challenge. So we thought, how do we deal with this with hospitals overflowing with patients? So we came up with the idea of an emergency health package. And the idea of that is to provide emergency relief efforts to 30,000 workers and migrants in 30 slums across the country. That project is under implementation today as we speak. At the same time, we have been looking at the employment needs of these migrant workers, and there are a lot of challenges with many of them wanting to stay back in their states when they've returned in the East, but some also going back to the cities. And we are trying to put together a Rozgar project with some NGOs to ensure the safe passage of these workers back to their workplace, and also a better understanding of their legal rights so that they actually are able to access all the employer and government entitlements that are due to them. Thank you very much.
Thanks a lot, Siddharth. Thank you for this brief background on Daily Wage Worker platform. I would like to introduce our another speaker, Rahul Roy. He's the member of Gurgaon Nagrik Ekta Manch. Rahul, I would request you to briefly introduce the organization, but also tell us how you collaborated, being a citizen in the Millennium City in Gurgaon, how you collaborated with schools, residents, and the municipal corporation to provide food and ration kits with the lockdown, with the cases going higher. How did you do that?
Well, thank you, Divya, and thank you everyone who's behind organizing this webinar. Couldn't be a more opportune time. Okay, quickly, now Gurgaon Nagrik Ekta Manch is a unique citizens platform. It's not registered. It doesn't have an organizational structure. It doesn't have a bank account. It doesn't have an office. And yet it is a platform which brought together almost 200 people who've been working for the past 3 months. This was not our mandate. Gurgaon Nagrik Ekta Manch actually came up in 2017 as a response to certain communal incidents that had happened in Gurgaon around the Friday namaz, which were being stopped in public spaces. And this was a citizens' response to that violence that we saw unfolding. Now, the unique thing about Gurgaon Nagrik Ekta Manch is that it is truly a citizens' platform in the sense that it has all kinds of people who are part of it. So you have people from the corporate sector, you have people from trade unions, you have people from the media, you have people from the medical fraternity, you have people like me who are filmmakers. So it's really a broad citizens platform. It's in the best of the citizens' spirit. Now even before the lockdown started, we had started speaking within the Manch that somehow we will have to step in. And 27th March is when we started distributing food and rations to begin with. But the first thing that we did was to set up an information system, an information hub, which we thought was going to be very critical to any movement forward, any work that we were going to do. So what the information hub was tasked with was to start collecting all the distress messages and calls that were coming in. At that point of time, since we had just started, we were not getting those calls, but they were already alive on all the WhatsApp groups that we were part of. So to begin with, the information hub started mining and archiving all those distress messages and calling those people back and finding out actually the details of what the situation is, what is the need. So that information hub became really critical to it. And once, of course, it became more active, we ourselves, but that information hub started producing all the assessments that we needed to look at in terms of whether it was rations or cooked food distribution. So that information which was being produced by the information hub started coming to, we in parallel set up a distribution team. It started operating to begin with from one hub where we started packaging rations. These rations were being packed with the view that they should last for at least a week, 10 days for an average family of 4 to 5 members. So we started with these dry ration supplies, and then very quickly we realized that within a few days that people actually needed cooked food. And then the third part which was set up was the cooked food distribution part, which we started with one kitchen to begin with in collaboration with Sri Ram School. Sri Ram School has a running canteen. They were kind enough to offer us that canteen and kitchen. And we started off from there, and then we added 2 more kitchens. And at the peak, we were distributing about 25,000 to 30,000 cooked meals every day. And by the end of, we now stopped distribution of cooked food, but overall, we distributed about 20 lakh cooked meals through this entire period. As far as concerned, we distributing dry rations, it's become more targeted. Earlier, it was more universal. Whoever was calling in, because we felt and we believed that distress was universal. So we were providing rations to everyone. So till now, we've distributed about 27,000, ration kits, which approximately has supported 1,25,000 people in terms of food security. And then various other things got sort of added to this entire process. One was that we realized that since we were collecting this material, this entire information around distress, that we needed to put it out and we needed to use it as advocacy. So then we set up a small research and advocacy team, which has produced 2 very important reports that have informed our own work, and it has been used to put pressure and as an advocacy tool to push for certain measures to be, policy measures to be taken by Haryana government and the Gurgaon administration. Also, the information team also added IVR system. So we have an IVR system which gets operational at points of time. This IVR system has been used both for generating information around for research, which has gone into the 2 reports I mentioned, and strategize our own systems in terms of getting a sense of what are the distress levels, what is the financial situation, how much ration do people have, what are the needs, what is the employment situation. So this IVR system has been trying to generate information around that. Then we also have, in a small way, because as we all know, a lot of people were trying to leave at various points of time. And towards the end of May, June, there was again a big movement of people leaving because job expectations didn't measure up. The opening up didn't happen as people were expecting. So there was again a big movement of people going back home. And at that point of time, a lot of people, not just in Gurgaon, but in various other cities, were helping the migrants go back through buses. Through teams started working even on helping people get back home. We have now moved towards some other, interventions, right?
Rahul, I would, come back to you to know more about the other interventions and introduce the other speakers as well, because, touch upon, what exactly these organizations are doing and then come back to you on that. Thank you so much. The Information Hub sounds like such a great idea to respond to the migrants' distress calls in real time. Is just amazing. Our next speaker is Vaishnavi. She is a volunteer with SWAN, which is the Stranded Workers Action Network. Welcome, Vaishnavi. I would like you to introduce the organization, but also if you could explain us how does the cash transfers program works within SWAN for these migrant workers?
Okay. Hi, everyone. Thanks for this platform. So I'm from Stranded Workers Action Network, and we are a very relatively new network. We came as a response to the crisis. We started on March 29th, and we are not a registered organization, NGO, or like we don't have bank accounts, nor do we are a registered organization. So we are a group of maybe 160, 170 volunteers spread across India, and we are a group of researchers, academicians, students, and like all sorts of people. So our work is essentially two things. One, we were involved in providing immediate relief to the stranded workers, and based on our work, we were building a lot of public dialogues and discussions based on the work as evidence. So this is essentially what we did in the last couple of months. And as you mentioned, one of our main interventions is providing cash transfers to the workers. We do micro cash transfers let's say, it started with 300 rupees per worker. And as the donations came in, as we got more donations, we gradually like increased the figure. So it worked out for the workers also, because usually we would get stress calls from a group of 4 to 5 workers. So it would turn out to be 2,000 rupees, 2,500 rupees for a group of workers, and that would sustain them for a week or 10 days. And the cash, and all of this was around just Google Sheets, using spreadsheets and directly connecting donors directly with the workers. We were not, since I already mentioned, we didn't have any bank accounts. The donors would be directly transferring the money to the workers. So, which also means the donors, individual donors that we had, they were all mostly small donors. And we have managed to reach out to 35,000 workers, and would have dispersed 55 lakhs so far. And this is essentially what we did. And if we had bigger groups, we would probably reach out to the local administration or local NGOs for assisting us in providing relief to them, because for a group of say 20 workers, the cost turns out to be high. So we were not really able to help in those cases. So we would explore other means of like directly getting ration delivered to them, or connecting with them with the local administration and making sure that they get ration and those kind of things. So when the workers called us, usually it used to be like 80% of the calls were SOS calls. When we say SOS calls, they just had 100 rupees left with them. And these are documented in our surveys. So 60% of the workers who called us just had 100 rupees when they called us. And 85% of them, actually, when in the second, even after 2 months, they didn't have access to any government PDS entitlements of those kind of sorts. And most of the calls were from main cities, Bangalore, Delhi, and Mumbai. And we really felt we had to like keep the cash transfers going, because though there are a lot of organizations which are providing ration, there are like a lot of other costs which involved. Like say when the COVID situation started, they were required to like say wash their hands like so often. But in a country like India, where people had to pay to use public toilets, they didn't have money. And same way, if they had to buy vegetables, they didn't have money. For phone recharges, they didn't have money. And like say in Chennai, for drinking water, people had to pay money. Like that's the situation there. So they didn't have money for all that. So cash transfers did a lot of sense to us, and that's what we concentrated. And meanwhile, while doing all these documents and like evidences, we also were involved in a lot of policy and advocacy platforms where we contributed to the public dialogues around the crisis, and also the response of the government by documenting how much of entitlements are actually like reaching the workers and those kind of things. And also we helped when elder workers doing the travel part by collaborating with other organizations which were already working on those issues. So
thanks a lot, Vaishnavi. You've been doing great work, and I we would want to know more about the wonderful reports that you have been working on and developing and producing, like you mentioned, for your policy and advocacy efforts in the next round. But I'll invite our third speaker, who is Siddhartha Prakash. He introduced himself briefly a few minutes ago. Siddharth, you already introduced the organization and told us about the three major thematic areas Daily Wage Worker platform is working on. But could you tell us a little bit more about the emergency health package? We have organizations addressing food security needs, employment needs, and from you, we would like to know more about the emergency health package, especially because I know Daily Wage Worker platform is using telemedicine in lieu of social distancing a lot in this project. And it was only yesterday that I saw a report, online report.
Hi, Priyanka. Can I just intervene? This is Pratik from Bridge India. Sorry, everybody, to keep on seeing polls come up and then close down on their screen. Whichever panelist is closing it, please can you not do so? Bridge India webinars have polls throughout, so please don't do that. Otherwise, I will take you off the video.
Sure. Thanks, Pratik. So yeah, I was saying that especially because it was, I think, only yesterday when I saw this news report in Indian Express that from 1st March to 31st May, telemedicine has increased 500% in India. So this project and the discussion is very timely. So could you tell us a little bit more about that?
Yes, thank you, Priyanka. So as we know, the COVID cases have almost reached 950,000 in India, and the hospitals are overflowing. So, normal people cannot get access to healthcare. With all the lockdowns and other challenges, it's even more harder for the migrant workers and daily wagers to actually access healthcare. So we actually came together working with a doctor friend of ours to develop an emergency health package. And the idea was to provide basic healthcare to people in slums. So basic healthcare we talked about was basically screening, diagnosing, providing free medicines, counseling about COVID and social distancing, as well as referral to local clinics and hospitals to the extent possible. We then found a number of organizations that we would like to partner with. So we are partnering with Operation Asha in Okla, with the Smile Foundation in Hyderabad, and the medics in Angul in Orissa. And each organization will be using their own local expertise and resources to deliver this package of emergency health. So in the case of Operation Asha in Delhi, they will be looking at a special telemedicine package, which will actually be able to very effectively diagnose the heart condition and monitor various things, the pulse and other things, and various health indicators using the telemedicine software. And the doctor will be able to, in real time, be able to also hear the heartbeat and other things, so that they can have a much more efficient diagnosis taking place. And then treatment will be provided by the doctors, prescriptions, and local pharmacies will be delivering the drugs to the patients. In the case of the Smile Foundation, they will be looking at mobile health. So they have mobile medical vans, and these will be moving around across the slums in Hyderabad, providing healthcare. And they will be connecting with local doctors and nurses using their online platform, as well as having a direct reach to the patients and communities at the same time. Then we move to Angul in Orissa, where we will be looking at the medics, which are a group of doctors who will be doing screening camps, awareness, and also using WhatsApp to connect the local district hospitals and specialists for people. Because what's happening is with COVID, the normal diseases, the non-communicable diseases, heart disease, diabetes, and so many other things are not getting treated, and access to patients and physicians is becoming a very big challenge. So the whole idea was really to provide, healthcare at the doorstep, and at the same time deal with all the challenges that are coming in the process. So for example, one of our NGOs is facing operational challenges because a lot of their health workers themselves have got COVID-19. But that's, I think, the challenge, and that's what we really want to learn about as daily wage worker. Does the concept of an emergency health package work in very different geographies, using different teams, using different technologies? And most important of all is that this is a cost-effective project where we are looking at providing basic healthcare at 1 rupees 25 paisa per migrant per day.
Great. Thank you so much, Siddharth. I know about the project and I'm sure that everybody else is excited to know more about it, especially the way you ended it, that 1.25 rupees can actually help workers per day. That's amazing. Our fourth speaker panelist is Father Noel. He's the director of Don Bosco Network. Father Noel, your organization has been providing jobs, skills, and legal aid to migrants. And in the initial period of lockdown, the food security needs were met by civil society. Then civil society organizations like Daily Wage Worker Platform and other organizations are trying to address the health problems migrants face. Now, the biggest and the biggest question for these migrants is employment, coming back to the state they were working in. And for that, the solution has to be long-term. So could you tell us a little bit about how do you go about your efforts in providing them jobs, skills, and then legal aid? Over to you, Father.
Okay, can you hear me now? Yeah.
Yes.
Thanks to Divya for the introduction. Hi all, and thanks to Bridge India Daily Wage Worker Platform for this invitation to speak. I'm going to share my screen because to run through a few slides. I don't know, it is put as disabled. I don't know that possible to share the screen. I'm getting a pop-up saying cannot share the screen. Hello.
Hi. I can read it. It says that
disabled. Yeah.
Yeah, the sharing screen aspect is not possible. Pratik, can we quickly email it to you, and if you can share your screen?
No.
Unfortunately, I don't think that's going to be possible. Father Noel, is it okay if you could go without that for now?
Okay, I just go on.
Apologies
Thanks.
for that, Father.
Yeah, because we tried that earlier. I thought it's possible. That's fine. So I titled my talk as the self-reliant life of dignity to everyone, from the perspective of the self-reliance mission which Prime Minister is talking about. And Don Bosco has been in this self-reliant mission for a long time. And so what does it mean? Every migrant is a guest employee. He is on a self-reliant pursuit. And this is the bottom line of the, the presentation. Why Don Bosco is interested in the migrants? Because Don Bosco himself was a migrant and he left his house very early and then got on to a city. And so when he grew up, he saw the real plights of the migrants and he started this whole work in 1841. So for 180 years, Don Bosco has been working with migrant youth. So it's a great legacy we have. So now the whole rising up because of COVID has happened. So Don Bosco worked for the rights of the young people and saw that they got their placements properly, they got their skills and livelihoods done. So that is about Don Bosco. Now, it is a dream which we are carrying on for last 180 years, I can say. And so it is continuing, and now it is very much in the limelight because of COVID. Don Bosco in India has been there from 1906, and we are in around 500 plus institutions, starting with some 300 schools and 400 skill training institutions and job placement centers, women empowerment program, climate concern. All these are a big. So at a real time, we'll be reaching about 1 million people in India. And we are a network of around 360 NGOs only involved in social development, leaving alone the schools, etc. And our signature work is for people who are working children and youth. And we have centers in 72 cities. And we call them sort of migrant desks, and they are in the process of being set up. And this is going on for a long time. And I would say that our education and skilling has been very much known, and we have big leaders like Piyush Goyal, Sonowal from Assam, and Smriti Irani and all coming out of our schools. And in COVID time, and I should say all of you shared how much you have taken forward, and we have reached around 2.5 million. There is 25 lakh people in some way or other. We have given them ration kits, we have given them health kits and counseling and cash for transfer, all types of services. Okay, so all of us are looking at the possibility of today addressing the employment. Yes, Don Bosco has been in employment. We have a job placement network, especially in the south, very strong in Chennai, in Bangalore, in Hyderabad, etc. And we are still setting it up. We have an app which can help the migrants. We have a portal which can do. Okay, unfortunately, I can't show the presentation, but we have a project we are trying to float called SMILE. And in this, we are trying to sustainable livelihood for migrants. So this is possible for two main things. So migrants, we say white collar, blue collar, and we also talk about no collar. That is the group whom we are reaching out to, and the migrants who are not having any skills at all. But I would say they are guest employees who have provide multi-service to everyone. And they are more a big resource that we have to look at. And so we have centers in Kerala called a Christmas project, which is looking at all the angles which most of you are speaking, legal, health, ensuring them with what you call their entitlements, accessing the government schemes and so on. It's a huge package which is being done. And similarly in Chennai also we have. So we look at the migrants in the source and at the destination. And so now we are dealing the problem at the destination, trying to set out a migrant desk, trying to give a helpline. And the whole lot of work has to be done with a framework both at the source. You set up a basic minimum legal framework a migrant should know, or a guest worker should know before he leaves, and he registers himself there. And then he comes down to the destination. Already the information is sent in the destination where the manpower data has to be generated so that we can match this skill of this guest worker down in the destination. So this is what we are trying to do, both ends. So certain in Tamil Nadu and in Kerala, it's quite advanced and they are doing well, but we are trying to set up a whole job placement network for these guest workers across the country. So what we are looking at from the daily wage worker and the Bridge India is, I hear that you are a group of lawyers to come out with a good package of a legal system which can be standard, can be a booklet, something can be given to a migrant in different languages. So when he sets for looking for self-reliance, then he has got this book, he knows where he is going, what he can get, an awareness can be created. So, and then in the source also, and the destination also, he gets somebody to support him with all this awareness program. So this is what we are looking at in Don Bosco, and we'll be very glad to partner you, various networks we have seen, you have presented, and today we had a big consultation in our network internally. We are going to come up with a national level pan-India plan. We'll be looking forward to collaborate with you all, see that we can all take care of our migrants. And the last word I would say is, everyone is a migrant on this earth and everyone's life matters. Let's not forget, man-made barriers generate migrants. I'd say once again, man-made barriers generate migrants. And every citizen in this world is with No, every migrant is a citizen of the world with a right to dignified life. And that's what we believe in Don Bosco. And we want to give every young person a chance to live a decent, dignified life. And thanks, and we pledge for a self-reliant life for dignity, self-reliant life of dignity for everyone. And this is what is the punchline of Don Bosco's efforts to support migrants. Thank you very much, Bridge India, and thank you for this opportunity.
Thank you so much, Father. And like you said, every citizen, every migrant is a citizen, and they have a right to lead a dignified life. So we've introduced our speakers, they've introduced their organizations. I have a few questions for our speakers. And my first question is, what challenges have you all faced, while bringing your efforts together for the migrants? And what were the lessons learned? I'll request Rahul to tell us what two major challenges, the Gurgaon Nagrik Manch faced while putting all your efforts together. And, if you could tell me two top lessons. I'm sure there were several challenges, but we would like you to restrict it to two so that, we can have all the speakers share what challenges they faced while they were trying to help out the migrants. Over to you, Rahul.
See, challenges, there were many, and a lot of them were about, related to getting things done. But I think the biggest challenge, at least for us in Gurgaon, and I'm sure in many other parts, not all, is that as to how difficult it is to get the government machinery to move and to collaborate with and to get them to see reason and sense. So for example, even before the lockdown started, people had started speaking about the importance of the universal PDS, that make rations available to everyone so that you don't end up in a situation where civil society has to step in and provide food. It's not that not enough food grains that the government they have enough, but that's been impossible to move administrations and governments along those lines. So that is just one example of, and the multiple examples I can give you as to how it's very, very difficult to get governments and government and administration to do sensible, rational, and reasonable things. And I think that, at least to us, was a big, big challenge as far as the work was concerned.
And what would you say was one of the biggest lessons learned?
I think the biggest lesson learned for all of us is that how close hunger is to this country. That, even a few days of people not getting wages reduces families to a situation of starvation and hunger. So I think that is the biggest lesson coming out of this entire pandemic as to how distress is actually an ever-present danger in most Indians' lives.
Absolutely. I would now request Vaishnavi, if you could also share your perspective on what challenges SWAN as an organization faced with, the organization's built up of volunteers, and if you could think of one top lesson learned, while working all these months.
Okay, so as an organization, I mean, ours was anyway a response to the crisis. So again, we face the same issues of, as much as we are educated, English speaking volunteers, even then for us to get actual information about the crisis or like any kind of information from the government, even for us, it was so difficult. I would say like there was complete lack of transparency and accountability in terms of communication, especially from the government. Especially related to stranded workers. Even after like 60 days, 90 days of the crisis, there was no clear communication about travel or what are, or like how do they access their entitlement. There were different signals constantly and confusions and so many things. So there would be one day there would be trains and next day they would cancel that there wouldn't be trains in Karnataka government. All this caused severe distress to the workers. And basically working around the system was the most difficult challenge for us. So very surprisingly, we didn't have, say, problems in getting donations or like getting workers, people together to work together, those kind of things. Although we are 180 strangers who worked just behind a screen, we were in complete synchronization towards one particular cause. And donors, though it's an unknown organization, they were quite good and kind to give us money to do the work that we did and all that. The main challenge was dealing with the workers, sorry, with the government. But although I said like it's dealing with the government, there were like one or two government officials that we had to like hold on to, who were like very responsive to our work and like who did help us. We should give acknowledgement to those one or two individuals also. But again, as a system, it needs to work for every worker and it has to work every time. And that's when you can call it as a system, right? So yeah, that would be the challenge. And lesson I would say is just I mean, like I hadn't worked on workers issues previously, labor issues, workers issues previously. So I would just say like the existing faults in our country about like having all these biases, this caste biases, class biases, I just felt it completely like got exposed during the crisis. And the lack of local presence of local self-governments, and then their inability, or like they don't have the resources to cope up with the system and those kind of things. I think that's probably what I learned. And I also understood the importance of labor unions and unionization and collective, the need to come together and have a collective voice, because whatever workers managed to achieve during this periods of time, like even after a period of government's apathy towards their crisis, I think it was because they were able to come to the streets, and also like so much of media's efforts had gone into talking about all that. So I think maybe the lesson is importance of collectivization and raising voice together. So yeah.
Thanks a lot, Vaishnavi. And like you said, it's amazing how you never fell short of donations. You know, it's such a good news. And, you know, we've seen that. And that's also the relevant topic of our webinar today, how civil society came together. And there was absolutely no dearth of donations. And like, you know, Rahul said, they were making 25,000 meals every day. But yeah, like a systemic effort from the government was something which was maybe lacking. Siddharth, would you want to share with us what are the challenges daily wage worker platform faced, and you know, a top lesson learned for the organization in this scenario?
So yes, Daily Wage Worker is really an organization of volunteers, and initially our online platform was collecting information on the relief efforts to help share that information, coordinate and improve delivery on the ground. The biggest challenge was actually accessing this information, because we worked during the lockdown period and most people were not able to move around. So it's basically what was available through hearsay, WhatsApp, newspapers, and on public domain. So we did manage to get a lot of information on what was happening on the civil society stuff. We got some corporate information, but from the government side, there was very little information available. And what we saw is that the state government, some of them did a great job, like Kerala, Orissa, for example, you know, reached out to their 650,000 self-help groups to distribute the rations and things like that. So there's some good lessons learned. So I think the lack of information was a big challenge. And I think the lesson is really that what's come to fruit is that the three sectors, the public, the private, the government, and the corporates really need to come together to solve this problem. It cannot be just left to the onus of civil society, you know, and charities. This is a very serious problem. You're talking about an informal sector of people, workers, daily wage workers, who their entire livelihood, their reason to exist is on their daily meal, which is only sustained through, you know, that 500 rupees that they earn on a daily basis. And if you're locking down a country for 90 days, you had enough time as state governments and central governments to respond, even if you didn't in the first month, in the second and third month, and even for the future days and months and weeks. It is very critical that, you know, all the packages and relief measures that have been offered to the migrant workers are actually dispersed through the various schemes. And it is our hope that all of us can also work together to ensure that that does happen.
Thanks a lot, Siddharth. Father Noel, I would want to ask the same question to you. If, Don Bosco, like you said, is present in more than 3-4 states, it covers all the 4 states in the south and Odisha as well. So what are the challenges your network or an organization faced while putting all the efforts together for the migrants?
Okay, there's a correction. Don Bosco is across in 28 states in India. Okay, that's all right. So that's not important. I think we are just talking about getting ration for the people and looking at the migrants as somebody we have to do something. I think 3 pillars are there to solve this problem. We need to look at migrants as partners. There's a huge human resource. That is what we have in the country when you talk about 65 million, 80 million migrants. It's a resource we have to look at. And 3 pillars which should work on. We as third parties who are there, NGOs trying to bridge between the government. Government has got a lot of laws, a lot of schemes, a lot of entitlements for the migrants. So the whole challenge today, I'm not going to talk about what all the migrants lack. It has exposed a whole lot of things, starting from health security, food security, economic security, livelihood, all these are shattered. And this COVID pandemic, nobody seems to be having a clue. The government is trying to do something, lockdown and lockout, and the NGOs are trying to do something, and the migrants are totally lost. They don't know what to do. We sent from one of my friends' organization called Healing Field, they sent 40 buses of migrants to Bihar, UP, and all that. They had this contact. Now those migrants are calling back, why don't you organize buses to come back and work? So it's a whole confusion happening. And I think what is basic is their entitlements have to be given. That these people have their rights. Why don't these people have ration cards? Why are not they getting ration cards? And some of them don't even have Aadhaar cards. We were trying to give, some donors wanted all the details of Aadhaar cards, etc. But these people don't even have Aadhaar cards. So the basic things of entitlement is missing. So the whole challenge is how we sort of ensure and empower to this huge human resource, I would call a partner, guest workers who have multiple skill providers. For them, we need to ensure that they have their rights restored, or they have awareness, first of all, where they can access their schemes and funds, etc. So we as a bridge between, it's a beautiful name, Bridge India, I think all of us together should bridge the big gap between the migrants and the government, whatever is trying to offer, and trying to give them a sort of a decent life. This is what is the whole focus. And the entitlements, I said some legal framework should be made known to the migrants, even simple people, so that they know where they can get what they want and have access to the resources, so that they are not left high and dry in normal times and also in times of disasters. I would call a natural disaster, which is also a health disaster, which has hit everybody. So our duty to see that public-private partnership is ensured and make sure that these migrants get whatever they are due to get. And how long will we go on distributing ration? I don't think it's going to be possible. Unless we make them self-reliant and have access to the resources, this is going to be forever a problem.
Thank you so much, Father. So we have a lot of interest from the audience. I know a lot of you have some questions. I will come back to you shortly. I will reduce some of my questions so that we can attend as many questions as we can. So Father, to your last point, I wanted to ask a follow-up question. So how do we create employment for these millions of migrants who want to either come back to the state they were working in or stay back in the same state? And after Father, I open the floor to the other speakers as well. If you have any ideas or suggestions.
I think the key crux of the problem is we are all data-driven society. So how much of data of these migrants we we have at the source and at the destination, and we need to match the skill which is coming in to a destination and see what manpower requirement is there. So a whole lot of, as Rahul was saying, it's beautifully networked with different sectors in the society. The Builders Association, the lawyers, the medical, all these have to be networked. We need to create a forum in the every city or every destination and also the source, so that this forum collects all the data, ensures. And we, like our organization, I think some of the governments also have apps for these migrants where they can register and put in their data looking for work. And so this data has to be shared between the states and between the organizations which are there, so that we can support these migrants both at the destination. So the data has to be classified, first of all collected, classified, and then put the bring these migrants on this framework, legal framework, which I was talking about, which has to be provided. And there are a lot of laws, but simple legal framework which every migrant should know, and they can access both at the destination, at the source, the helplines and migrant desk services available to get what they want.
Absolutely. Rahul, has the Gurgaon Nagarik Manch discussed this in terms of, you know, what can be done by a citizens group or influence or work with the government to provide livelihood to at least some of them, because also domestic workers are a part of migrant workers?
See, the point is this, that we've been doing what we could do, and we will continue to do what we can do. But it's important to understand that civil society has its limitation. Governance is not the civil society's responsibility. Providing social security is not the civil society's responsibility. You know, following laws of the country is not the civil society's responsibility. Those are all responsibilities of the government. Now, is the government willing to follow its own laws? Is the government willing to follow its own regulations? Is the government willing to walk the talk as far as social security is concerned? Those are really issues that civil society cannot, and we can go hoarse and we can put all our might to this, we will reach nowhere, because we are not the state. There are issues that only the state can address. And there is no reason why we should be actually, to be honest, I don't see any reason why we should be distributing ration or cooked food. Why should we have come to a situation that we are doing this? It's basically reflective of two things, that what I said earlier, that one is how close distress is to Indian, working class lives, and the failure of governance. Those are the two primary reasons why we've all, Don Bosco has to step in, and Gurgaon Nagarik Ekta Manch has to change its mandate and step in, and thousands of individuals and groups have done exactly the same all over the country. So the point is this, that is this the moment when the government has to be put under pressure to start becoming and following, and doing what its mandate is. And I think the civil society now really, if it has to make a significant contribution towards shift and change, then it has to be to put pressure on the government to start doing governance, and transparent governance, as Vaishnavi was saying.
Absolutely. Thanks a lot, Rahul. So I'm going to quickly jump to the questions I'm getting.
Priyanka,
Yeah.
I would like to add to what...
Absolutely, Vaishnavi. I was actually coming to you with the first question from my audience, which was related, but please go ahead.
Okay. So what I mean, other than all the skilling and like all the other work which is being done, but also there has been a constant, like a good amount of push to for NREGA to be implemented. NREGA is National Rural Employment Scheme, and recently the government has increased the budget to like 1 lakh crores. And same way, activists are demanding such a similar program in the urban context also for the workers to be given work by the government in the urban context as well. So I mean, like as Rahul said, I think civil society, I mean, as I think our efforts should be like getting all these things just to monitor whether these things are getting implemented or not, rather than just like, being the providers of these kind of services. So yeah, I think as a civil society, our job is also to demand and monitor these kind of whether these things are happening or not. So yeah.
Absolutely. Thank you so
I
much.
can just add, Priyanka. Yeah. So I think I'll just echo what the other speakers are saying. I think the role of the government is very critical, whether it is food security or healthcare or employment. But where we can come together is really public-private partnerships. So for example, with the issue of employment, we are working on this Rozgar project. And initially we thought maybe we should just create an app and connect the employers and the workers. But then when we started to do our research, we saw that there are at least 15 organizations, 5 state governments that are developing apps that are leading this work. So why duplicate? So it would make much more sense for someone like Daily Wage Worker Platform to play that coordinating role and try to bring together at least some of these organizations who are willing to work together, so that we can come together and move from pilots in isolation, in silos, to reach some kind of scale and impact, rather than doing new projects, because the needs are infinite, clearly. And we can either choose to go our own way and impact 5,000 workers, feed 500 families a day, or we can take the big leap and come together, and 5, 10, 15 organizations and groups coming together. And the scale that we would reach in terms of all our work together, the resources and the reach, we could get into lakhs pretty fast and have public-private partnerships. Because clearly, while the government is responsible, it is clearly not able, it doesn't have all the resources to solve all these problems. So if there is a public-private partnership opportunity, and there are many successes and failures of these, but if we look at the successes, there are lots of opportunities for us to come together, and we really would request that you join with Daily Wage Worker Platform and use this platform to share information and bring projects together so we can collectively reach scale. Because we are a facilitator, we cannot ourselves create the healthcare and deliver the jobs. But if we come together, I think we can strategically have a much bigger impact.
Absolutely. Thanks a lot, Siddharth. So I'm going to come back to the questions we have from the audience. We have a lot of questions and interest. The first question I have here is, and unfortunately we had to disable all the microphones for the audience. I will be reading out the questions and request either one of you or all of you to respond in your own capacities. The first question is, how can the government's slow response communicated back to them so that they can be more responsive in the future? Like, they've been slow, and it's important to communicate that to them so that they know that something like this can not happen again in terms of their response.
If I may start, I think it's about getting the government's attention to say that, whichever plan you look at, you want to go back to, Bharat Nirman or 8% GDP, and, show India is the country of the world to do business with and what a great nation we are. We have to look at our backyard. We have to look within and say that 90% of your workforce comprises informal workers, migrants, wagers. If you just completely ignore them, how will you run your economy? How will you sustain growth and deliver what you promised to your electorate? It's a very simple thing, and you see the fruit of your labor, because now what's happened is, after the migrant crisis, there is an acute shortage of labor in these cities, because you've got almost like 30 million people who've walked, or however they've reached home, they've gone there, and many of them do not want to come back. So without this labor, how will you achieve the economic growth that you want? So ultimately, the social side of development has to be taken care of. And if India is a signatory to sustainable development, growth, to green growth, and all these things that we say that we are, we have to put the migrant worker and daily wage worker at the core of our own national self-development and sustainable development goals. Otherwise, there will be no economy, there will be no growth, and there will be a very bleak future as we have seen. So it's really a question of saying, economy with the people.
Absolutely. Is there any of other speakers who would like to also contribute to what Siddharth said?
Father,
I'd like to go on, and I completely agree with the panelists, both Vaishnavi and Rahul. It's a huge responsibility of the government that they should look at this problem very seriously, at least at this time. What we are doing is a drop in the ocean. I don't want to say we are doing something, but it's not going to solve the problem when NGOs or civil society step in. I think there are a number of states who have set up some sort of desk for the migrant. For example, the Odisha government has got a desk in Tirupur where their migrants are coming. So, but when the COVID happened, nothing was happening on the desk. So this is the real story. When something has to happen, we need to ensure whether all these systems which are partially set up or new forums we need to set up, looking at this migrants problem. We have the whole labor department. I do not know whether they have any special sector only for these migrants or the guest workers we have. So it again have to see the law body or the law lobby which is there. I think many of the lawyers association, every step now, when we have these problems with the migrants, we approach, there are some goodwill lawyers who are trying to support in each of the states. I think we need to network them also and bring them on board and see how they can ensure also to negotiate with the government to see these things are taken forward so that their entitlements are given.
Thank you so much, Father. So there's another question, and I think at least Swan and Don Bosco, because they, Don Bosco has a presence in 28 states, and Swan has been doing extensive research. But Siddharth and Rahul, you're also, please feel free to answer this. The question is, why is the migrant worker crisis so different across the states in India? Why can't we have a uniform response nationwide?
Okay, so should I start? Okay.
Absolutely,
so,
Vaishnavi.
Okay, so based on our experience, we were like, though we were spread across like say 5 zones. So I handled South Zone, but even in the South Zone, there are like 4 states which we handled, and the nature of problem and response was very different in like all the 4 states. Like say Kerala has been more successful, like because of the decentralized structures which exist in Kerala. In Tamil Nadu and Karnataka, like had a very different response to the in providing the help also. Like say in Tamil Nadu, it had like industrial cities like Tirupur and Coimbatore, where the nature of crisis itself was different. Like say in Coimbatore, there would be 10 workers staying in one room for a lockdown, and those rooms were not meant for workers to stay there for like 24 hours. So this problem would be so different when you compare it with North Karnataka problem, where they had a very different kind of structure and like the existing problems. So I don't think, like what we have understood from this entire crisis is localized, decentralized solutions have been more successful rather than one solution for everything. Wherever there have been decentralized, localized solutions, I think those solutions have been the most successful. If there is one thing that we can learn from this response to crisis, I think it's that. So so I would think there can't be a uniform solution for all the states. Example, South states are richer states. They are in capacity to deliver much more, and the bureaucracy and administration capabilities are different compared to poorer states like Jharkhand, Bihar, where now the migration has gone back. So
yeah, exactly. And like you said, like also in India, we have fewer states where the outstate migration is so high. For example, Bihar, UP, Odisha, Madhya Pradesh, as compared to a Punjab or a Haryana, or a Himachal, where the outstation migration is not that high. So, and also, like you said, state governments work differently. they have different systems. Kerala trade unions work very differently than, a trade union somewhere else. So that's why, and India is so diverse as a country, as a socially, culturally, it just becomes sometimes very difficult to have a uniform response. Rahul, yes, please, go ahead.
See, while of course the response will change and shift and there'll be local factors, of course, that's true. But there were a couple of universal principles that had been discussed right from day one, and one was, which I'm again and again bleating, and all of us who've dealt with the situation know, is universal PTS. This was a universal principle that should have worked across the country in all states, and it doesn't matter which state then it is. The second issue is, which came very early on from the medical fraternity, was the fact that your mainstream healthcare system is going to collapse. It's not going to be able to deal with this. It's not been managed to deal with in New York, so forget about what's going to happen in Gurgaon. So what the alternative had been proposed right from day one was community care systems. To develop community care systems, which were, and it did happen in Dharavi itself. It is a great example of what happened, what has happened in Dharavi and many other areas. But that should have been a universal, principle that should have been followed in all the states, to actually from day one, when the lockdown, the so-called lockdown for preparation happened, that you set up community care systems across the board and get a lot of people involved in that. That should have been the second universal principle to be followed. And both were not followed at all. The first one was not followed anywhere. The second one, because of individual, and certain civil society groups, and in certain cases, specific local administrations, it came into being, and it's been greatly successful.
Absolutely. So in interest of time, I'm going to move to this next question because it's already past 7. There's a question: how can an individual such as myself, one of our audiences, help in these efforts? Can they volunteer? Can they donate? How can they get connected so that they can also, contribute to this crisis positively? We have all the organizations who work on volunteer basis. So any one of you or all of you want to take this on, please go ahead.
Well, the person should obviously look for which are the groups around in wherever he or she is, which is working in the area and can join, or even see, I think a lot of, they've been, the great thing actually about this entire, experience has been how individuals have also done a lot. It's not just groups and institutions and platforms, but actually hundreds and hundreds of individuals have at their own level, even when people were walking, early on when people started walking home, there were thousands of people who were running on scooters, on cars, or just standing outside their homes, giving out biscuits, giving out water, giving out all kinds of things. So it's, if you want to do something, you will find a way of doing it by just looking and seeing where the distress is and what you can do as an individual to address that distress around you.
Absolutely. Siddharth, would you want to add here?
Yes, as far as daily wage worker is concerned, I would echo what Rahul says. I think it's about individual contribution. So you could contribute to our projects like Swaasthya by donating. You can also become a volunteer with us. We just received 20 volunteers this week actually who want to join us, which is great because we do require health specialists, labor lawyers, and other experts who can help us solve challenges like the ones that Vaishnavi and Father Noel are dealing with. Also, if you can also mobilize the support of other organizations to also join us and your own organization so we can reach scale, because I think scale is really the need of the hour today.
Can I step in? So,
absolutely,
today,
Father.
One of the beautiful things as this infection is spiking, what we saw right at the beginning of the day, I would say the solidarity also was spiking. It is all coming from the civil society. I think a lot of good people, Indians who feel that they are real citizens, they have to go out and support their brothers and sisters. That was very, very strong. And I should appreciate all, and especially the organizations which are. I want to make one more point. Why this migration is happening? We are I think our country is a huge agricultural country, and most of this migration is happening as a distress migration of the landless workers. And if agriculture is put in real place, we were in skilling, okay, we must have skilled around 4 lakh young people in the last, say, 7, 8 years with our technical skills. But all the skill had to migrate from the rural area to the cities. But when they reached the cities, did they get the jobs? And even if they got the jobs, did they get the right wages? And especially young people moving from very rural areas to city, they are facing a whole lot of problems and social, moral, and they're being exploited in every way. So this is creating a problem, this migration. And so I think it's a good time our country look at agriculture as seriously, where people can find their livelihood. With this modernization and technological developments, lot of real local livelihoods and artisan works, all this have been shattered. And so people are just giving up agriculture, selling lands and coming away. So if we are not going to tackle that part of it, this migration problem will continuously exist. How many jobs can we find? This is not going to be easy. There is a saturation point, even in the cities. It is all service providing sectors like hospitality and domestic and hotels and different parts and computers and so few technical skills, but there is a saturation point. All cannot be given and driven to the cities. So agriculture needs to be important, and new innovative way of doing agriculture and create a sort of interest and incentive the government should keep to hold people where they are. So certain amount of migration is possible, but not this whole of a lot of distress migration which is happening in our country, where they don't get their livelihood and they are driven to hunger. So it has to be looked at in a larger perspective, just not the migration, but the livelihoods in the country, especially in agriculture, which is our the core, I would say, important sector of occupation for the people in India.
Absolutely. Thank you so much. There's another question that large number of the workers in the informal sector are women, but they have been largely invisible in migrant worker discourse. What can be done to help women migrant workers especially?
So
Yes,
I would, I mean, I will respond to this question, but also previous to the previous question, I would like to add something. So for me, yeah, like as already mentioned by the other two panelists, the individual response has been the, I mean, if we are forced to look at some silver lining out of all this, it's maybe that's the one thing that I would say it's a positive thing. But other than that, I think I think we should not view this as just one short-term crisis and like all of us can move on with our lives. No, it's not that. If all of us, we have to individually contribute to this, I think we need to be more interested in the local politics of these kind of things. I think the political apathy comes from the people that we elect. So I think as an individual, the most we can contribute is using your privileged position to be aware and also spreading that information and taking a stance on these issues. Okay, and about the women migrants, yeah, I mean, as it is, the situation of women is not very great in this country, but especially during this crisis, they had I mean, they had like different levels of issues, like issues of domestic abuse, of being home for so many days together without any work, and also not having access to any kinds of state mechanisms to even in times of crisis, they were not able to reach. Like we had like a lot of distress calls where women workers would call us out of sexual harassment to report it and all those things. But even if they go to try to use the public system like police or court. Like simply they just didn't have the access to it, and they obviously didn't get any response also. So yeah, the saddest part is they have always been invisible, and I think they've just become more vulnerable at this point.
If I can just add, I think the self-help movement, which is pretty much abundant in India, unfortunately, it's very much a rural phenomenon. If that can be applied to the urban areas and to the cities where you have these mobile populations, where, you know, resident welfare associations and local governments and corporates could actually chip in, you know, and get, like, in your neighborhood, you'll see there construction sites coming up, there are a lot of women there. If you can just mobilize them together, give them very small microfinance grants, they could actually very quickly, you know, start small enterprises and start earning income and become financially independent. And this is a very simple, tried and tested model which can reach scale very fast.
I agree. I think we do have a lot of lessons to be learned from rural India, at least in, you know, urban poor and urban slums and an urban migrant scenario. I'm going to read out the last question, which we can take for the evening today, which is, a lot of these migrants are seasonal workers. What are the policy makers thinking, or what can they do to have a separate policy for permanent and seasonal migrants? Father Noel, would you like to take this question?
What are the policies? Once again, please.
Yeah, so a lot of these migrants are seasonal migrant workers,
yeah,
who go in one season and go back to their state, for example, Bihar or UP or whichever state. But there are also migrants who've migrated from their home state many years ago and they are settled in a new state. So the person asking the question wants to know, can there be separate policies? Is the government doing something about it? Or do you think that we should have separate policies for these two sections of migrant workers?
The people who have settled for a long time, I think they will get their entitlements by themselves. They are there for a long time. Most of their basic necessities or access to resources would have happened. I think the ones who are in real trouble is the seasonal migrants, and we have a good experience of migrants who are working, for example, in Jhajjar in Delhi. There is a big brick kiln, and people migrating from all states, UP, Bihar, etc. Their children, they cannot get schooling. We try to help them to get some schooling. They come for 3 months, they go back, and 6 months, they go back. So I think there should be a real framework which should be given both for the workers and the young people. The young people are the ones who are at bigger risk, and we should create a separate policy if we are going to continue to promote this seasonal migration. And why this seasonal migration is taking place, most of them are working in agriculture. And when the agricultural season goes and they don't have any other livelihood in their own place to earn. So if we can create this livelihood in their own place, they wouldn't be moving. So at the source, we can see the possibilities of creating a livelihood. A policy should be made, as I said always. And then if at all they need to move, and then when they go to their places, if it is going to be a regular seasonal movement between point to point, then there should be also some systems set up. So definitely the policies would be different. And we need to, yeah.
Thank you so much.
If I can just add also to what Father Noel said, I think today the government of India already has a number of laws that support daily wage workers and migrants, from the Interstate Migrant Act to the Building and Construction Workers Act and so many of the others, that actually provide very clearly defined entitlements for a migrant to be registered, to have an allowance to travel, to have a subsidy when they reach the city. And then when they're handed over to the employer has very clear obligations, from actually even just paying the salary on time, to providing proper accommodation, to providing decent work conditions, like access to a toilet. If in the construction or hazardous industries, if a laborer has an accident, that their healthcare is taken care of. The biggest challenge is that from the government side and the employer side, the enforcement is either minimal, weak, or just not there. And this lack of enforcement is actually the biggest root cause of the entire migrant crisis, because on the one hand, they themselves are not even aware that they have a right to a ration card and food security, a right to healthcare, and the state universal healthcare coverage scheme that they should be going into as BPL people. Even employment, they have rights to actually get into government schemes. They have employers who have rights that are to be allocated to them, and the entire negotiation process between the worker and the government or the employer is so skewed and uneven that they really aren't able to even know their rights, empower themselves, and even access and utilize those rights. Because and I think that's where we need organizations like our partners here to change the dialogue, to change the frameworks and policies, but also implement the existing policies, create that awareness so that the migrant knows I'm entitled to A, B, C, and then they can actually challenge the system to access those rights.
Add to what Siddharth said, I'm very much aware these laws are there. Actually, lots of laws are there. But what is happening is the migrants and the people enforcement departments, they don't know. So like anyone who goes for a job in a normal sector, they have an induction program. And why don't these people who are guest workers, we would like to call them, with this, they have to move, then they should be in the source destination, a sort of an induction program, creating a whole lot of awareness. That's what I was talking right from the beginning. We give them a booklet of whatever they are entitled. And they also get a sort of registration that they are moving out of the state along with this whole lot of induction program. I think then they will also stand up for what they can access, stand up for their right. So this is what would be, I've been saying right from the beginning, both at the source and the destination, sort of induction centers for people where they get their awareness on the rights. Along with this, the enforcement departments also should be called to take up this and create, maybe, I do not know how many of these enforcement department have the real awareness and are out there to support the migrants. So this awareness seems to be one big gap. And we have for farmers, for example, a sort of a radio program which is happening, some television program. Why don't we, the media, take up some sort of awareness program for the migrants, and we can do an ad for the migrants. What are they entitled to? I'm just talking out of my head, says one. So this kind of interventions would create a lot of awareness, and that would perhaps ensure what we are all driving at.
Thank you so much. Before we close, and I would request all the speakers to give 1 minute closing remarks if they want to add anything they couldn't share earlier. Can we start with Rahul?
Okay, thank you for organizing this, and it's been lovely to hear all the other panelists and to get the questions also. All I want to say is that, look, the issue is, it's not that the government is unaware of what the problems are. They've always been aware of what the problems are. They are aware of all the laws, existing laws. The administration knows much better than us all the regulations, laws, protective measures, social security systems in place much better than any of us. They know it all. The point is, of course, one is that, as Father Noel was also saying, that are those measures ever, and as Siddharth was saying, that are those ever going to be enforced, or are they enforced? That's number one. We know the answer to that. Number two, I think what I want to end with is that there is, there are larger questions that are being posed to us through this COVID. One is, we, of course, are trying to answer them through these specific, debates around migrant workers. But I think we've reached a point where there are no simple answers and solutions anymore. And we need to really figure out as to what does excess means to our social systems, our society, and our aspirational systems, whether it can really sustain us, whether it's in the context of rural India or whether it's in the context of urban India and cities. I think there's some very fundamental questions here which we need to really start answering, and unless we get into those, we'll be floundering.
Thank you so much, Rahul. You've made some very important points towards the end as well. Vaishnavi?
So I think we, as a society, maybe need to stop looking at all these standard workers as beneficiaries or someone who's, I mean, basically as beneficiary. They are, I mean, we need to give them the, I mean, they need to have the equal voice as citizens of this country. So, I mean, maybe only the mainstream society and the government, if they acknowledge it, I think that's probably then I think it'll work. As everyone else has said, there are so many laws in place. It's just like it's not getting implemented. So I think the entire system needs to get reformed, and it just can't happen only by the government. It has to come as a larger consciousness about treating a fellow citizen as a citizen rather than as anything else. So yeah, only that kind of awareness and acceptance would, I think, would result in actual delivery of these kind of things. You're on mute.
Thank you so much, Vaishnavi, for making these important points. Father Noel?
I'll go back to affirm what Rahul said, very much well said. And I would say that the country is on a self-reliant mission. If every individual is not self-reliant, the country will not become a self-reliant. So every migrant, everyone is a migrant on the planet Earth, and everyone's life matters. And so a self-reliant India is possible only when we can make every one self-reliant to live with dignity. So a self-reliant life of dignity for everyone is our target. And I think both the government and the civil society should look at this and pledge for it. Otherwise, we'll be having many more webinars and it will not be solved. And I would like to say a big word of thanks to Bridge India. I hope they will keep bridging us and the whole country. I think this is a big challenge for them. And for all those who have volunteered to do this, it's a very good job. And we need to have more conversations, but towards also people, I think we need to bring people also who are in the government side, in the labor department side to hear us. Otherwise, it will go on deaf ears. So thanks once again, and let's make everyone self-reliant in India. Thank you.
Thank you so much, Father. Very important point that maybe next time we should also have some government representation to know their views and what's going on there. Siddharth?
Yes, I would like to call upon, all our democratic right to help. And here I'm talking about corporates and state governments. I think corporates, they have a mandatory policy of 2% of their profits have to go to CSR. And I would really appeal to them that they invest this on improving the lives of the migrants at this time of need. And also call upon the state governments. You collected a lot of money from your PM and CM's relief funds. It's now time to distribute that money. And to end, I would like to end with a quote from Mahatma Gandhi, who said, "There have been tyrants and murderers, and for a time they can be seen invincible. But in the end, they always fall. Social COVID-19, this too shall pass." Thank you.
That's a great quote to end the webinar, Siddharth. Thank you so much. A big thank you to all our speakers and the amazing audience to make this webinar so valuable. And I would also like to say a lot has been done, but it's never enough for a country like India. So I think the immediate future needs help from all of us, all the organizations, speakers, and the amazing audience we've had. And before we close this webinar, I would also like to thank Bridge India for organizing this and collaborating with us, and request all of you to please follow Daily Wage Worker platform and Bridge India on all the social media handles, including Instagram, Facebook, Twitter, and LinkedIn. The next webinar by Bridge India is on July 25th about Atmanirbhar Bharat. Thank you so much, everyone. Have a great evening.
Thank you.
Thank you.
Thanks, Siddharth. Thanks, Divya. And
Thanks, everyone. Thanks, Divya.
Thank you.
Thanks, everyone.
Thanks, everyone.
Thank you.